Thank you. So, hi, everyone. I am really pleased to be here to present the work of my Play to Prevent lab now at Dartmouth College, as Jessica mentioned, as well as the lab sister organization, Playable. I want to thank Jessica and her team for all of their support and for giving me this opportunity to be with you today. So just a quick disclosure. So I am also founder of the sister organization of my lab, as I mentioned, called Playable, that really focuses on the distribution of our video game interventions. So as Jessica mentioned, I'm going to be talking to you today about the global adolescent mental health crisis and the role of digital health games in closing the gap. I think she walked you through sort of where my position is. I am just reaching my 1 year time point, having joined the faculty at Dartmouth and in the Center for Technology and Behavioral Health there. So I'm going to be talking through some of the background on our games. We have 5 digital health games that target really some of the most critical health outcomes in adolescence, with a significant focus on mental health. And so, so that's going to be the main focus. Talk a little bit more about just our games in general, but to focus on mental health, I am a member of a newly formed global mental health task force in partnership with the United Nations. And so, and they're very intent on exploring the power of digital health games to target this mental health crisis. So let's get started. So not new news to this group. There is a global adolescent mental health crisis. 15% of the world's adolescents, which equals about 195 million young people, struggle with mental health issues. Many before the age of 14, many go undetected. And historically, during the first year of the COVID-19 pandemic, globally, 1 in 4 adolescents experienced symptoms of depression, 1 in 5 symptoms of anxiety. And these rates continue to climb through the pandemic and unfortunately have not abated. Less than 1/2 who need treatment have received it. And we know that mental health stigma is a major barrier to seeking help. In a recent meta-analysis examining barriers to seeking help in young people, 92% of these studies reported perceived social stigma and embarrassment as major barriers to seeking help. And further, this mental health crisis is fueled by social media use in young people. You can see the relationship here between social media use and rates of depression. In fact, just recently, Vivek Murthy, the US Surgeon General, released a new advisory on social media and youth mental health, calling for warning labels on social media sites. So we know that there are a number of issues around this environment where young people spend a great deal of their time. And so at the Play to Prevent lab, we focus on addressing these issues around the youth mental health crisis. For the past 15 years, we just celebrated our 15th birthday last month. We've developed, evaluated, and implemented digital health games as video games that impact health behavior in teens and young adults. And so how do we address the major health issues of adolescence, including mental health? Well, 95% of adolescents play video games. Digital health games, such as serious games, which are defined as video games designed for a primary purpose other than just entertainment, are now seen as effective interventions. And so how might they close the gap in the global adolescent mental health crisis? So first, they meet adolescents where they are and where they want to be. We can demonstrate fidelity to the dose of the intervention of the game. They don't require significant manpower to implement, so potentially cost effective. They're scalable. And we know now that they can have increased reach and impact. So this is our portfolio of 5 evidence-based digital health games. We have developed them in partnership with commercial game developers. Primarily Shell Games is our commercial partner. Scientists and content experts, and really importantly, in collaboration with our teen partners who have been involved from every step of the process from day one. Our games cover a range of adolescent health issues, you can see here, including smoking and vaping, opioid misuse, sexual health, and they focus heavily on mental health, both in the development process that we use and the outcomes that we test for. Generally, they cover an age range of 10 to 20, although each game has its own very specific age target, depending on what the specific topic is. They are all web mobile, fully accessible on any device. And so they can really be played anywhere, anytime that a young person is. So in addition to high levels of engagement and accessibility for youth, our games are evidence-based. They're backed by now increasing amounts of published efficacy data that we have published in over 25 papers, including reporting the outcomes of now 5 randomized controlled trials. And as I mentioned, a number of our games currently focus squarely on mental health in young people. I'm really proud to say that in the last couple of years that our games have been included as critical resources around mental health for young people by the Office of the U.S. Surgeon General. And so I'm going to focus this talk, and you can see this sort of mini outline here, on 2 of the games that we have developed, Play Smart and Empower Ed, that address mental health, and then a few ongoing and future projects that again address youth mental health. These include teens in schools with mental health clubs, young people in Greece and Cyprus, and then the idea of integrating health content, specifically mental health content, into widely popular game platforms for adolescent students. So let's first start by talking about Play Smart, which is the first game that I mentioned that has been developed. We're completing a randomized controlled trial. This is our 5th video game intervention funded by the National Institute of Health as part of the National Institute on Drug Abuse's HEAL initiative, which stands for Helping to End Addiction Long Term. This was created through extensive work with our game development team, Shell Games, scientists, and as I mentioned, adolescents, really being involved at every step of the process. It focuses on mental health promotion and then also the prevention of opioid misuse in high school age teens. And you can see this is an example of a home screen. The player creates their avatar, names them, gives them certain attributes. You can see here the storylines and the mini games in this specific game. And you can see the storylines are really what deliver the content. The yellow highlighted ones are the ones that focus squarely on mental health. And then the mini games are the opportunities for players to go through activities for skill development. And you can see the 2 here that are again highlighted in yellow that focus on mental health. For example, Stress Sense, which is one of the mini games, teaches coping skills and skills around reframing negative thoughts. So I'm going to just play a quick demo. Again, this is just a video. Play Smart is actually about 6 to 8 hours of unique gameplay, so highly interactive and very complex in terms of the game mechanics and all of the content. But this is will give you a little bit of a flavor of what the gameplay looks like.
Play Smart is a game about making the right decisions and taking care of your mental health. You learn lessons throughout the game that you can carry with you in real life. Through storylines and mini games, you learn about the importance of your own mental health and the mental health of others. In one storyline called A Friend in Need, a friend is experiencing some mental health issues. You try your best to cheer them up, but end up learning that sometimes it is best to let an adult step in and help. Throughout the game, you practice coping skills through helping friends in the Stress Sense minigame. Your friends deal with common struggles such as feeling down, having the loss of a loved one, and feeling left out. Through helping your friends in the game, you learn how to cope and how to reframe your own negative thoughts. In PlaySmart, when you are looking for help for your own mental health, you go through the storyline A New Direction, where you learn both the importance of therapy and how to find the right therapist for you. In PlaySmart, you practice skills of coping and reframing and learn about the importance of mental health and where to go to get support. The lessons you take from the game you can use in real life when talking about and looking after your own mental health. PlaySmart was developed by the Play to Prevent Lab. For more information, please visit playtoprevent.org. PlaySmart is a
So again, that's just sort of a snippet, gives you a sense of some of the mental health focus and content in PlaySmart. As I mentioned, we're at the tail end, thankfully, of a remarkable team effort getting this large randomized trial completed. This has been based in approximately 15 schools in Connecticut. Our goal was to enroll 532 adolescents ages 16 to 19. We actually enrolled 533, so had an extra person in there. And these folks are considered at higher risk, meaning that they have to meet some eligibility criteria of at least low levels of mental health issues or low levels of non-opioid substance use, since one of the areas of focus is on preventing opioid initiation. They're assigned to either the PlaySmart game or a set of control games, and then we collect data at baseline, 6 weeks, which is sort of at the end of gameplay, 3, 6, and 12 months. So just real quick, just looking at some of the baseline data. Again, this is, as I mentioned, there's some eligibility criteria around some, level of mental health or substance use. You can see for this group, really significantly high levels of, 72% of them reporting at least mild to moderate symptoms of depression, 81% reporting at least mild to moderate symptoms of anxiety. And then you can see some of the substance use that they report. But I think even though mental health, issues was a potential criteria because they could have just some non-opioid substance use, it was pretty striking to see such high levels in this very general high school population. So I will come back to PlaySmart because some of the sort of ongoing and future projects are based on that game, but I just wanted to quickly talk about one of our other games, which is called Empower Ed. Empower Ed is a game that also focuses really almost entirely on mental health. It is a much smaller game, while PlaySmart, again, is about 6 to 8 hours of unique gameplay. Empower Ed is actually just under an hour. And you can see we conducted this pilot randomized control trial. And, even after really what was probably about 45 minutes of gameplay, you can see that there were some pretty significant impacts in the Empower Ed group in terms of impact on cognitive reappraisal skills, as well as their sense of beliefs and attitudes around their capacity to impact in a positive way the environment around them. So just another example of a game that we now have in hand and is being used by teams broadly. So I want to talk a little bit about some either ongoing or some other future projects thinking about focusing on specific areas around mental health. So this is a project that we have been working in collaboration with Bring Change to Mind. So for those of you who don't know Bring Change to Mind, it is a national organization that their model is to establish mental health clubs in schools all over the country. And these clubs are really established by kids, designed by kids, run by kids, by students. And so they're very student-centric. And we have been working with Bring Change to Mind for a number of years. We have more recently started partnering with the Geisel Institute, which is a fairly new established institute at Indiana University that is focused in part on mental health and mental health stigma related to it. So we conducted some formative work with both the folks at Bring Change to Mind and Indiana University to look deeply into both teen mental health and mental health stigma, with the goal of building a new game adapted from components of the Play Smart game that really solely targets mental health and stigma. And so, given that our process is to start with our end user, again, teens, we conducted, working with Bring Change to Mind and Indiana University, 11 focus groups, which involved 53 participants. You can kind of see their sociodemographics here. They were well represented in terms of gender, race, ethnicity. These were all kids who were part of Bring Change to Mind mental health clubs. And these focus groups were all conducted remotely. So this was all done over Zoom, and was done with kids really all over the country. I think 5 different states. So good geographical representation. I'm just going to talk really quickly about some of the themes that came out. You can see sort of the 4 major themes here that were identified from the inductive qualitative analyses. I'm going to focus on the second one, which has been particularly interesting to me and to my team, which is mental health stigma definitions and experiences. And so this second theme you see here, really the discussion highlighted 2 very interesting areas alongside mental health stigma. And these are the ideas of toxic positivity and trivialization. So participants raised during these discussions this notion of toxic positivity, where they shared that peers put on a facade that everything is great when it isn't. And this was something that was particularly evident while on social media. So really kind of highlight some of the issues and impacts of social media and mental health. This notion of toxic positivity leads to confusion about the realness of mental health concerns. It also promotes the stigma because it makes it abnormal if someone doesn't always feel great or happy. And you can see it from this quote here, where this young person said, it's like, sometimes I just want to be okay, that I'm not happy with it. Just let me not be happy with it for a moment. And just being able to be genuine, whether that's in a bad way, where it's like, I'm not feeling too great and that's fine, or genuinely, I'm feeling absolutely awesome and that's great too. So I think that sort of speaks to sort of how some young people, experience the environment of social media. The other concept is the one of trivialization, which is minimizing or oversimplifying mental health conditions. And so these were 2 themes that came out. And as I said, using this formative work, these focus group discussions to inform, specific areas to target around mental health and mental health stigma in this new game we're looking to develop. A future project that we are working on, and again, to think more broadly geographically, start looking at different regions of the world. We kind of know from the statistics I mentioned at the very beginning that this is a global mental health crisis in young people. In Cyprus and Greece, you can see some of the statistics here. Again, its own mental health crisis in Cyprus. 1 of 4 children in Cyprus experience mental health difficulties more than once per week. High levels of anxiety, irritability. In Greece, close to 40% of young people state that poor mental health is a problem that worries them the most. And, interestingly, and to their credit, these are areas that are an evolving and expanding national interest for both of these countries. So we have formed this partnership with CARDET, which is the Center for Advancement of Research and Development in Educational Technology. They have been partners for a while, but now we're thinking of establishing an official partnership to think about building out parts of the Play Smart game, working with young people and key stakeholders in both countries, in country, to modify, adapt, and evaluate the Play Smart game to focus on mental health issues in young people in Cyprus and Greece. I actually was just in Cyprus presenting in person at the Learning Innovation Summit for Cardat, and there was just so much interest in how games could really have impact in this area for young people. So this is again a work in progress, but exciting to think about expanding into different regions that not only have this ongoing mental health crisis, but obviously have huge amounts of trauma, especially related to war and conflict in the region. So lots of, fortunately or unfortunately, lots of opportunities to have impact. And finally, another project, again, early in development, is one that we are looking to address youth mental health by targeting loneliness in young people. And you can see from these statistics how prevalent loneliness is. Recent reports indicate that as much as 33% of the world's population is lonely, and clearly exacerbated by the COVID-19 pandemic. 1 in 4 young people feels lonely on a global level. And so this project, which again is very much in the early stages, but what we're thinking about is integrating health content, specifically around mental health, into a widely popular game platform for young people. So, while video games, part of the premise is that it's reaching adolescents where they are and where they want to be. Some of these super popular commercial game platforms is where millions of these kids are. And so thinking about kind of bringing it even closer to some of the environments that they're in. And so specifically what we're thinking about doing, again, is to likely use a platform such as Fortnite, which is an online video game and game platform developed by Epic Games. As of this year, there are approximately 650 million registered Fortnite players. A lot of them young people. On an average day, over 1 million players play on Fortnite. And so our thought is to build a game on Fortnite, working with our partners at Look North World, who builds games in Fortnite, partnering also with the Games for Change organization, which is a national organization that focuses on games for change, and potentially with the Deepak Chopra Foundation, since they have a major focus on mental health, with the idea of building a game that really targets loneliness by establishing skills around building connections, belongingness, if that's a word, and again, working from the get-go with adolescents and scientific content experts to really think about how we can target loneliness in this environment where kids are, so basically to give them a dose of something really healthy. So again, very much in the works, but something that we are building towards. So I wanted to sort of pause for a second. I talked, a lot about sort of the areas, the games that we have that are focused on mental health, projects that are either in the works or in the near future. But wanted to talk just kind of, go back to our games and talk a little bit more about, from my perspective, what I see sets us apart, what makes our games different. And this has, again, been 15 years in evolution. So it's, very steep learning curve, lots of experiences we've had to, sort of, reflect on and build and pivot. But I think I have some perspective on what I feel has been, really important in the games that we've created. So I've mentioned this. I think a user-centric approach at every step is absolutely critical. Again, and we learned this the hard way. I think we started out with our first game project and we're like, oh, we are smart, educated adults. We know what's going to work. And it became very clear very quickly that we didn't. And so we paused and we regrouped and started, again, this was 14, 15 years ago, started engaging young people at the very beginning with focus groups, with interviews, having them be involved with helping to write the stories, vetting the artwork, vetting the voice, every step of it, piloting the game when it was in its first preliminary stage. And so, really, to make sure that what we're creating is coming from their voices, through their eyes, their stories, because that's the only way it's going to have impact on them. And so, it was humbling, but also really important to learn that early on. And we've carried that forward such that every project we do, and you could hear from the Bring Change to Mind project, you could hear from the project in Cyprus and Greece, the idea is to really start with young people and then have them be involved throughout the entire process. It's absolutely, absolutely key. So the other part is really being able to demonstrate the impact of our games. I think we can all feel like, oh, this looks cool and this seems fun and the kids seem to like to play it. But unless we really document what we have accomplished with our target and users, it's speculation generally. So the idea really, in part, we have published broadly both on our process of developing games and also the impact of our games. And, in big part, really, as I said, to be able to demonstrate what did we accomplish, but also, really to be able to document what our process is, what we've learned, share with the scientific community who's interested in this work, what worked for us, what didn't work, so that it really became part of, this archive that even to this day we'll refer back to our papers, and, whether it's a protocol paper for an RCT or, a paper that describes the formative work, it's a great resource for us to be able to go back and be like, oh yes, that's what we did. It's been written, it's been published, it's a great resource for us, as well as, we hope for the scientific community or anyone who's interested in digital health games. So this is another part that I feel is really important, and does set our games apart, is that we've been able to really demonstrate impact, and we've shared all of this data, process and outcome data, broadly. And finally, and this is much more of sort of part of the work that has been in process for a number of years, but I think we're increasingly focusing on this area, is the notion of our games, not only as interventions, which is certainly where they're primarily developed for, but that they also potentially can play a role as assessments and a new data source. And so this is a study that we conducted a while back now in somewhat of an exploratory fashion to examine the in-game data produced by the game software. So each of our games, the software produces an enormous amount of what we coined in-game data. And this study looked at how that in-game data might correlate with standardized survey data that we collect. And what we demonstrated from this study was that completing and beating, so this was based on our first game, which is called Play Forward, that for players completing and beating more of the game levels, but not total game time, was related to higher knowledge scores at the 3-month and the 6-month follow-up on our standardized assessments. So part of the relevance of this was not only showing that we could say that kids who played the game well had higher knowledge gains, that there was this correlation between how they performed in the game and what we could concretely demonstrate in terms of what they gained as represented by, the assessment data. But a question that would come up frequently would be, well, if you have these gains after 5 hours, then why not? Then maybe they should play for 10 hours. And what this study, again, in an exploratory way, really demonstrated was that it actually wasn't the amount of time, it wasn't the quantity of time of gameplay, it was actually the quality of gameplay. So it was the kids who really performed better or had more sort of comprehensive gameplay, that we saw these gains, and not necessarily how much time it took. The findings from this study also highlight the potential contribution of video game intervention, as the ones we've developed, can make to the study of health behavior change. So specifically, the use of this objective data that is produced by the game software during a player's gameplay, so it's collected real time, can help potentially mitigate some of the challenges of self-report data, which is also what we collect, and potentially provide insights into player behaviors and risks. And that's the part that we're sort of have been moving forward and thinking further about this. So what we're really been looking at is how these in-game data, what we'll call performance data, may translate to digital biomarkers that allow us to use gameplay as a potential screening tool, or sort of the components of gameplay that we can pull out, leading to actionable next steps for intervention around, say, mental health or other outcomes, specifically with higher risk kids. So, for example, and this is just a sort of a graphic to sort of give an idea of sort of what the different components might be. So performance in a game is influenced by cognitive processes, and deficits in these cognitive processes can increase the risk for certain outcomes, such as mental health issues. And therefore, what we're calling in-game performance metrics may represent digital biomarkers of cognitive processes that can offer an objective method for assessing underlying risk for those specific outcomes. And this is really involves a lot of data mining in terms of these in-game data, in terms of building models to start describing what these different facets of gameplay might represent in a young person. And so the next step in looking at this and working in partnership with Deloitte Canada, we created a data dashboard with data fed directly from the backend system of each game to this portal that would then sort of synthesize and consolidate sort of all of the components of the gameplay. And this is something that you can look at individual players, you can look at an aggregate for a group of players. And what this data dashboard represents or presents is in-game user engagement data. And this is a wide range of elements, such as time spent, rate spent per user on each story or mini game, all the different components of each of the game. It also provides key metrics that I mentioned, such as reaction time or time for task completion, that may correlate with specific cognitive processes. So we're starting to look at this relationship more to fully explore the power of these in-game data, and thinking about games again, not just, that's a big just, not as interventions alone, but also as potential assessment tools or ways to use it as a different data source to really tell us something about our player that, that they may benefit from us then intervening if there seem to be ongoing issues. So just to wrap up a little bit, this was a lot to cover in terms of, not just the focus on mental health, but sort of what are sort of the elements of our games and the process by which we develop them that I feel are really critical, as well as this notion of all the data that they produce, which was, quite frankly, came about with our first game that we developed, 12, 13 years ago, but really is compelling in terms of thinking about what it may tell us about players. So just to summarize, again, there's a global mental health crisis impacting young people and a gap in solutions addressing it. So digital health games play a major increasing role in addressing these gaps, having kids playing in high schools, having kids playing in high school mental health clubs, focusing on mental health stigma, adapting to other countries and cultures as part of national initiatives, as I talked about, Cyprus and Greece. And then thought of addressing loneliness through this online multiplayer video game platform with the goal of building collaboration, connectedness, and belonging through a game. And then further, in addition to being interventions, our games may serve as assessments with the objective data collected through the game software, which may in some part mitigate some of the challenges of self-report data, translate to representations of cognitive processes, and down the road, potentially identify individuals at greater risk of certain health outcomes, including mental health issues, potentially expediting referral for earlier treatment for those who are identified as needing it. And so in general, all of these opportunities for games as interventions and as assessments will expand on a global approach with the goal of reaching all young people everywhere through the power of play to improve their health and well-being. So I'm going to say thank you. Thank you for joining, and I am happy to take any questions.
Wow, thank you so much. That was fantastic. So much information to think about and consider. Lots of questions came in. People were super engaged. And I see that some folks are raising their hand. I would just ask if you have a question, please type it into the Q&A box, and I'll try my best to incorporate it, although there's a long line. So I'll try to jump around a little bit based on what folks were sharing. But one question that came up is about and you touched on this a little bit with the sort of screening potential or assessment potential and referral to treatment. One question came up about integrating gaming therapy into mainstream mental health services. And there's one way to do this, which you described, which is through entire schools, giving a game to everybody and maybe using that as an opportunity to identify kids who could be elevated. But this individual was asking about the possibility of giving a prescription for a game through a doctor's office, primary care, for instance, which is a very different dissemination pipeline. I'm sure you've thought about this a lot, and I'm curious how you think about prioritizing pursuing one avenue over the other, and why.
So great question. So thank you for that question. I think like everything in that we do in research, there is no prioritizing. It's sort of, we just try to do all of it at some point. I think what interestingly, to that question, what has evolved very organically, we are the play to prevent lab. So the focus from the get-go is focusing on prevention. So really primary prevention. And what has kind of come out from, and this is really from the environment speaking back to us, is this need for, that's fine. That's a great implementation, say globally in all schools, to provide this type of content. But hearing from folks, folks who work in juvenile justice, folks who work in, adolescent psychiatry clinics, who exactly this are really looking for more for interventions. We've moved from tier 1 to really tier 2 and tier 3. And, and to me, that's super exciting because it's like, the feeling is that, especially with juvenile justice, they want to move more towards kind of a restorative justice approach as opposed to punitive. And so the notion of being able to use a game to, provide this content for kids who are struggling with a whole range of issues, to be productive and positive is something that we are responding to fully. So I think we're trying to do both in parallel. From a prescription standpoint, I've gone down the whole FDA discussion path and all that, sort of where I landed, and I'm sure I'll probably come back to it at some point, was that, it wasn't necessary to have, FDA clearance or, to be able to implement these in clinical settings. Still up for discussion. This last randomized trial of PlaySmart, we actually have done it with extra pain and suffering. all within FDA compliant methods. So that may leave that door open for that game. But, again, great question. Lots of applications.
Awesome. Another question came in about attrition.
Mm.
So you, right, the forever topic. So you
Yeah.
touched on this a little bit by saying that quality, not quantity of engagement seems to be what mattered, at least in that one trial. But this individual was interested in learning more about how often kids start the games and then drop it pretty quickly after only a little bit of engagement. And are the effects driven primarily by folks who have a certain floor of dosage? And so, like, what do you consider a minimally appropriate dose for a video game?
Yeah. No, and again, another great question. I think that, that earlier exploratory study, gave me some reassurance about, again, that amount of time versus quality. I don't feel like it was the definitive study, but I think it was helpful information. One of the real assets of games is that we really don't have to push kids to play, and that is so for our first randomized trial with our first game Play Forward, that game is about 16 hours of unique gameplay. Those kids in that randomized trial played on average 10 hours, completely on their own. I mean, it is very much like, a research, since it's a randomized trial, research team is there, but kids could get up and go to the bathroom, or they could go play basketball or whatever, but they really get pulled in. So, we have really to date in looking at this issue of time does not seem to be, a major influencer. But I think the question of minimal dose is an important one. And I don't think we've answered that one yet. So,
Well, we can chat about that at some point.
yes.
So another person had a couple of really good questions. One, just curiosity, is this available beyond the trials? Are the games available beyond the trials? And maybe that's what Playable is trying to do.
Mm-hmm.
And also, is there a component where players' input can sort of continuously inform adaptations to the games? I imagine that's complicated with the software development or backend development that happens in the video game pipeline. So I would be curious to both of those things.
Yeah. So to the first question, so you're right. So I spun out Playable a little over 3 years ago now because of the demand. Like, with the lab just couldn't respond. We didn't, we are doing research, we're doing development, we're doing trials. We just, and we don't have the expertise to really, how to get, build these partnerships and these channels and these networks. And so I created Playable really specifically to focus on that, to, focus on, ways to get these games into as many kids' hands in a whole range of, so schools, juvenile justice, clinics, and that just takes so much more expertise and specific expertise. So to answer that question, I'm always happy to send out subscriptions for folks to try out the games. If we're doing large scale implementations, then that would be through Playable, because that comes with professional development materials and tech support and all the bells and whistles. But I'm always happy to share the games, because I think they really speak for themselves. I can only describe them or show a video to say so much. So that is the role of Playable. The issue around, being adaptive. So the games are interesting because each game is essentially the player's own game, because things unlock sequentially and players can choose their own ways to go, and so there is some, in a structured way, kind of behind the scenes, there is that type of, adaptive notion that, each player really kind of plays their own game. But I think, and I hate using the word artificial intelligence, but I think, that maybe, and along with machine learning, really, has a role in future steps in terms of really building out that adaptivity. So that you can really, so that kids, we can identify real time through their gameplay what areas they're benefiting from the most, what areas they need more exposure to, sort of pushing them through those areas. Obviously testing all of this first, but I think there's huge areas of making this much more precise and sort of tailored to the individual, for sure.
Awesome. Sorry, questions keep pouring in, so I'm trying.
And
Um,
folks should feel free to reach out
we have
to
a
me
little
by
more time
email.
though, so I think we can
Yeah,
get
yeah,
to
yeah.
this
No,
stuff.
I'm just saying that.
Um, so one person asked when designing the games, and you touched on this around your focus on user-centered design and involving teens from the get-go, but they're curious what cultural aspects and elements of background of teens were actively considered in that process, and would also be curious to hear about that.
Yeah. So I think again, this was part of the learning curve, because each step, first of all, society changes around us, and there's different areas that really have emerged as being, critical when we're thinking about, dealing with, health content or sensitive issues, especially with young people. I think part of the advantage of, even though I am now on faculty at Dartmouth, I live in and have lived in New Haven for many, many years. And, New Haven is considered the greatest small city in America as sort of representative of kind of bigger society. So it's a very diverse community. And the schools that we've worked with have been very diverse schools and you can see this from our randomized trials. I mean, we have a really diverse population of kids in our trials. And so I think, again, having that input from a diverse group, hopefully kind of, hits on some of those issues. So it's not just one voice, it's a whole bunch of voices. And then again, with our most recent game, we were really focused, again, working with young people on having gender neutral characters and having, a lot more, again, we're learning as we're going and seeing what are areas that, more diversity of our characters and more diversity of their backgrounds and trauma and all these other things. So I think we have gotten better with each game, but certainly the diversity of the youth we work with has been really, really helpful.
Awesome. Several people asked, can they have the slides?
Oh, yes.
Okay. Wonderful. So they should contact you for slides if they have.
Yeah. Yeah, that would be great. I'm happy to send those.
Okay. That covers many questions. Um, one, I like this question. What career advice would you give to early career folks interested in pursuing research in digital health gaming?
So it's great. I can tell you that I ended up in this very serendipitously. I am trained as an internal medicine doc. So I take care of adult folks. I'm also trained in addiction medicine. So, the first like 5 to 7 years of my research career, we're focusing on building treatment models for adults around addiction, mental health, HIV. I also worked in HIV medicine. And, what I was finding was that more and more as I took care of patients, a lot of them young adults um, in clinic, or they were enrolled in, one of my studies, I would hear over and over again, they would say, oh, if only I knew then what I know now. I would have made different decisions. I just wish I had the information, the tools, the skills. So that kind of got me thinking. And then at the same time, I was raising 3 teenagers in my house who were all playing games and also all exhibiting adolescent stuff. And I just thought, well, maybe a video game, right? This is a captive audience. This is where they want to be. That's 9/10 of the battle. This would be the way to deliver content to them that they will be able to absorb and want to absorb. And so put in a grant to the NIH, really just proposing to develop and evaluate a video game intervention targeting risk reduction and HIV prevention in young teens. And they bought it first time round. And it was like, oh, okay, I guess now we have to do this. Which of course I had no, full disclosure, I am not a gamer. So I was like, oh God, I really need to like get, the right people on board. So that's all to say that, you know, the beautiful thing about this career is that you can go where you want to go, and you can and follow interests and leads. So I would say, go for it. There's huge opportunities in this area and endless applications. So, and happy to talk more with this person if they want more advice, because I just think that, it's been a great adventure. I have learned so much, and that I think is one of the most important things about a career is to keep learning. So
That's awesome. Kind of a tag along to that question. Somebody raised the issue that developing games is really expensive.
Mm-hmm.
So considering the, operational constraints that early career researchers are often up against, how would you suggest navigating that? Are there more affordable platforms that folks can use or turn to other options? There may not be, but wanted to ask.
Yeah, no, and I think that's, that's it's a very valid point. And I think that's where, as I described in some of these sort of current or future projects, is really kind of, overhauling and revamping an existing game that has these assets that have been tested and, are well liked and current, to then, hopefully, not only cut the cost significantly of a new game, sort of sort of a Frankenstein approach, but also the time, the development process, for this most recent game was 16 months, for our first game was 18 months. I mean, that's a huge chunk of time. So, but I think that there are other, so, Look North World again, which is this group that builds in Fortnite. They actually have a pretty, affordable approach to building games. I mean, their games, again, they're in Fortnite. Conventionally, they're focused on more commercial games, but you can build anything on that platform, and that is, a fraction of the cost. So I think there are lots of different options, but it is tricky because you want it to be good, and so it sometimes it does take money, but there are a lot of different options in terms of how to address that. So
And I think that's what you're highlighting, I think, is an important lesson for digital mental health broadly on the importance of collaborating with existing widely deployed systems rather than making your whole new special app over and over again.
exactly,
Um,
exactly,
yeah. And the
exactly,
power of partnering with things that are already there and already being used. Um,
absolutely.
other questions that folks had. One person asked about this is a measurement question. So they saw in the pilot evaluation for the empowered intervention or game that you did not use the PHQ-8 and GAD-7. And they're curious about how you made those decisions, how you make those decisions, because the PHQ and GAD are often just kind of go-tos.
Right, right. And that's what we as I showed, we used in well, the data I showed for Play Smart was actually, sort of screening data, but that's what we have used with the mental health outcomes for that game. I'd have to honestly look back
Yeah.
to remind myself, but it's a really good point. And I think the notion of measures, I mean, I have to say, after every trial I've done, I'm always like, why didn't we also measure that? Right. It's that sort of like, even if you've like got 15 different or 20 different assessments, there's always that like, we should have, looked at. So with Play Smart, we actually really, we included as much as we could think of. But I have to look back at that specifically to sort of see why that was not, if it wasn't included, why it wasn't included.
Yeah, no worries. One question that I find interesting is around just privacy concerns in these video games, because this is super
Mhm.
sensitive data, and also obtaining consent from teenagers who are sharing their personal health information potentially on these platforms, either for research or just generally. If they're not a
Mm.
research study, it could also be very sensitive. So I'm curious how you think about that.
Yeah. So for research, I mean, it feels equally as important, but feels more easily addressable, just in terms of all IRB approved certificates of confidentiality from the NIH. I mean, all those and we work incredibly hard with youth to make sure that everything is protected, de-identified, all of that. So in the research realm, that feels much more manageable. I think in the real world realm, that is really, really tricky. And it is really something that we've had to be very upfront with, whether it's schools or school districts, or now we have some state, you know, contracts to use games with youth in the state, that, that it's a shared responsibility in terms of privacy, and all that. So that's something I think in the entire world of broadly of educational technology is a nut that is still being cracked, because it is really challenging around, and what is identifiable information. And if you just, if you, have an IP address that could show where they are, is that there's so many facets to that. So I think real world, it's research I feel much more comfortable with. Real world, I think there are a lot of things, and there are groups like Common Sense who really focus a lot of their time on this question around privacy, that we're trying to partner with to really make sure that we're, as much as possible in the right space. So
Totally. It's so, yeah. It's challenging in research, but there are parameters at least.
exactly,
Whereas in the real world, it's just like, oh, we don't know how to do this. Um,
right no,
your response raised another question for me. Sorry to cut the line
okay.
of other people, but you mentioned ed tech.
Mhm.
And do you call this an educational technology? Do you call this a digital health tool? Like, how do you categorize what you do? And I'm curious, why do you choose that lane, or does it vary by context?
Yeah, so I think that has evolved over time, because I think I would have sort of originally kind of came from the ed tech frame, because we do so much of our work in schools. We do all of our trials in schools, we do, all our formative work working with schools, but then it's really evolved into, what we're focused on, even though, it's through different pathways, is these health outcomes. So I think, honestly, I think I've ended up with digital health education is kind of
Oh, that's
the happy marriage, because we don't do math,
yeah.
we don't do physics, we really do health. But it really is about, and it's more, educational. So, kind of education broadly, meaning it's, skills and knowledge and, attitudes, all these outcomes. But I think digital health education is kind of see where I see us land.
Awesome. So it's 1 o'clock, so we're up
Oh,
on time already. But thank you so much again for this awesome presentation. We all learned a lot.
thank you.
And
Thank you.
yeah,
This
it
was
was really
great.
Great.
Thank you, Lynn.
Appreciate it. Thanks, everyone.